Hello, I'm Altona Mayor Al Friesen. Thank you for joining us tonight. It was earlier today that Premier Brian Pallister referred to his current pandemic, our current pandemic, as a historic challenge. He and Dr. Rusin also announced the 4-3-2-1 initiative with a series of benchmarks with the number one goal of encouraging us to get our vaccination not once, but twice. The Altona Health Region rate of vaccination currently sits at 40%, compared with the Manitoba intake of 70%. Today's announcements help set the stage for tonight, a conversation about vaccination. And we thank you for your interest in learning more about a topic that's commanded our attention for the past 18 months. And thank you for submitting your questions to tonight's panel. Most longer-term Altona and Rhineland residents or their families have connections to tonight's guest panelists. Dr. Dieter Bueddefeld and Dr. Ken Kliewer served our region for a combined total of 7+ decades. I think I'm right with that number. I expect most of us can remember a family circumstance where one or both of the doctors were involved. In our instance, I recall where Dr. Bueddefeld set my son's nose after a baseball incident. Dr. Kliewer was the attending physician when my youngest broke his ankle playing soccer, and in another situation, made it to the hospital in under 2 minutes to intubate my son during a viral croup attack and probably saved his life. Our family experience is one of many, many examples over their careers in our town. For their lifetime of service, the town of Altona recognized Dr. Kliewer and Dr. Bueddefeld as Citizens of the Year. They raised their families here. They continue to live in and care for Altona. That sense of service brings them both here tonight. Thank you, men, for your willingness to help our community navigate one of the most significant health challenges facing our community and country since the 1919 flu. As mentioned, we've had a lot of questions already submitted, and we expect some more. But is there anything you'd like to mention before we begin? Dr. Kliewer.
Well, first of all, I'd like to also echo that welcome. It's good to have you people join us. We don't know how many there are, but there's 3 of us here on the screen, and we'll do our best. This topic is very important. It's relevant. The pandemic has affected millions of people all over the world, and most of the countries have been very badly affected. So it's serious, and that's why it's so important and good for us to meet here. It's not only out there, but it's something that has impacted, I dare say, all of us. I had a childhood acquaintance who was lost to COVID. My grade 8 teacher has died of COVID, and I'm sure most of you could tell similar stories. So my thanks to Mayor Al for getting this whole thing organized, and to Sarah, who's our producer. Thanks also for the personal well wishes that I'm sure Dr. Bueddefeld has received as well as I have. This is not, it's not without trepidation. It's a new experience for us, and we appreciate your support. So let's enjoy.
Dr. Bueddefeld.
Yes, thank you, Al, for that introduction, and thanks to you and the town for inviting me this evening. And I agree that this conversation is important. Dr. Kliewer's mentioned the scope of the COVID pandemic. And in spite of some entertaining stories and theories about possible sinister motives and conspiracies behind our current situation, the truth about the COVID-19 pandemic is really very simple. COVID-19 is caused by a virus, just like measles or influenza or the common cold. The difference with COVID-19, of course, is that it's more easily transmitted from one person to the next, causing it to have spread worldwide very quickly, and that it causes much more severe disease and more death than any virus that we've seen in many, many years. And unfortunately, as is the case for most viruses, there's no specific effective treatment yet discovered for the COVID-19 virus. So what are our options in this crisis? As for any virus outbreak, there are only 2 things that we can do. One is the public health measures. This includes wearing masks, social distancing, restricting contact with each other. By now, we all know that drill very well. And these measures do work, but they work slowly and incompletely, and we know how significantly they disrupt our lives. So while this option is helpful, it's far from ideal. The second option is a vaccine. Now, this option has been the ultimate weapon against so many viruses: mumps, measles, smallpox, polio, just to name a few. And we're so fortunate to have at our disposal a number of safe and effective vaccines against COVID-19 virus, which greatly reduce the likelihood of both becoming ill due to the virus and the likelihood of passing the infection on to someone else. In the past 6 months, real-life results in at least 5 countries have shown the virus, or have shown the vaccine to be on average well over 90% effective in preventing disease and preventing spread of infection in those people vaccinated. Now, those last 4 words are so important. The vaccine only works if it has been injected into your arm. Unfortunately, statistics have shown that many people in our town and in the surrounding municipalities have not yet taken that step. But until that step is taken, we won't have protection from the virus. And as a result, we will have to continue to see high levels of illness, and we'll have to rely on that distant second best management option, the public health restrictions. It's my hope that through the discussion tonight, Dr. Kliewer and I can provide some information about the vaccine, which might reassure any of you who have doubts about its mechanism and its safety, and thereby help reduce any hesitancy to rolling up your sleeves and getting vaccinated. So I'm looking forward to addressing your questions.
Thank you. As indicated earlier, also participating in tonight's conversation is Sarah Radmore, Town of Altona Information Officer. Sarah has compiled the many questions that have already been submitted and categorized them accordingly. Vaccine development, mRNA vaccines, what is in them? AstraZeneca vaccine, risks, should I get the vaccine? COVID treatment, getting a vaccine, and after the vaccine. We have a lot of questions, and in addition to the questions already submitted, we'll try to include some additional submissions that arise tonight. So how about we start? As mentioned, we will likely have too many, but the times indicated are rough, but we'll make our best to get through it. So questions so far, and Dr. Bueddefeld, I pose this category to you, vaccine development. How were the vaccines developed so quickly, and are they safe?
The development of the vaccine, of all vaccines, didn't have to start from scratch. For the mRNA vaccines, that's the Pfizer and the Moderna vaccines, the research and development of the technology has been going on for about 30 years, while work on the viral vector vaccines, the AstraZeneca and the Johnson & Johnson, has been going on even longer than that. So there was already an abundance of pre-existing knowledge that the current vaccine developers had available to build on. As well, in this situation, there was much more collaboration between researchers, drug companies, governments, due to a shared sense of urgency worldwide about the pandemic. And a third significant factor was the availability of funding. In the US, the Operation Warp Speed, as well as a European initiative, provided a lot of money for vaccine development. And this allowed for many trials to be set up and to be run simultaneously rather than one after the other, allowing subjects to be recruited for these studies much more quickly, and basically just ended up speeding up the entire process significantly. In terms of safety, the data that has come out from the vaccine trials and from the post-release information has shown the vaccines to be very safe, other than initial post-vaccine side effects. For the Pfizer and Moderna vaccines, there's been no really significant side effects identified. With the AstraZeneca and perhaps Johnson & Johnson, there's the issue with the blood clots, the VITT syndrome, which, although very rare as well, has been linked directly to the vaccine. The incidence of those side effects, however, for most people is still much, much less than the likelihood of having a severe bad effect from COVID infection. There's one other side effect that's been identified recently, and that's myocarditis, or an inflammation of the heart. But even this one is, I don't even think it's been definitely identified as associated with the vaccine, but it's being followed, and it's a treatable side effect. So really a very, very safe group of vaccines.
Dr. Bueddefeld, is the gathering of 1 year of data appropriate when the average phase trials are over 6 years?
Well, 1 year is certainly an unusually short period of time for vaccine development, no question about that. Because of the available funding that I mentioned, the trials were able to be run consecutively. They had enough money to do a lot more things at the same time. And in the development of any vaccine or any new drug, the clinical trials usually have what's called phase 1, 2, and 3. And usually these are run one after another. In this case, the phase 2 and phase 3 trials were overlapping one another. So as information, even before all the information from phase 2 was completely collected and analyzed, phase 3 was starting. So that allowed the timeline to be compressed further. Now, even though the data was able to be collected rapidly, it was still evaluated thoroughly and rigorously and had to meet the same standards of safety and effectiveness as any other vaccine has in the past.
Any concerns over long-term effects, or will it have long-term generational effects that you've come across in your research?
Well, long-term effects, I guess for anything, long-term effects, one can't prove with 100% certainty that long-term effects will not occur, whether that's a new vaccine or a new medication or something we buy from the store. But experience from many previous vaccines has been extremely reassuring in that long-term ill effects are not expected. The new technology on the block is the mRNA vaccine. So that's one that we might wonder about more. But the mRNA, the substance that's injected into the body that produces the protein that stimulates the immune system, is destroyed within a few hours after injection. So delayed effects are not really expected in any way, shape, or form. In any case, side effects will continue to be observed and reported for a year or more. And if at any time any ill effects are discovered, appropriate action will be taken.
Okay. Speaking of the rapid development, why would I take an experimental vaccine that only has emergency approval?
The approval process for COVID-19 was modified somewhat because of the urgency of the situation, but it still requires a thorough analysis of all the data, and the standards, as I mentioned, are as high as for any other vaccine that has come out. I think even more importantly, speaking directly to the question, why would you take an experimental vaccine? This vaccine is more than experimental. At this point in time, I think this morning when I checked on the website, 2.25 billion doses of vaccine have been given worldwide. That's a very large number, and that provides more evidence than any usual vaccine approval process ever would provide. And the evidence from those 2.25 billion doses has been overwhelmingly reassuring as to the safety and effectiveness of the vaccine.
Here's a question. The government of Canada is already offering to pay people hurt by the vaccine. So how can they be safe?
I think what you're referring to is the Vaccine Injury Support Program, and that was launched by Canada in December 2020. Programs like it have actually already been running in over 20 countries for some time, so this is nothing new. And I don't even think it was necessarily specifically in response to COVID-19, although maybe it was a little bit of an impetus to get this program launched. These programs are not started because a vaccine is thought to be unsafe. These programs lessen the risk for the companies that develop the vaccines by making it more likely, or thereby making it more likely that vaccine development and distribution will happen here. If the drug company that develops and launches a vaccine in a given location or country worries about potential lawsuits, whether they be justified or frivolous or whatever, they're going to perhaps think twice about doing that in that particular place. So I think Canada was really just catching up to the rest of the world and making sure that Canada is a good place to develop and launch new vaccines.
Thank you. Let's look at the vaccines themselves. And if you could, Dr. Kliewer, mRNA vaccines. What is in mRNA vaccines?
Before I go there, I'd just like to have one brief comment on Dr. Bueddefeld's first point about the rapid development. One of the other things that really worked in their advantage is that they very quickly were able to get 30 to 40,000 volunteers for their phase 3 trials. So that was big and was quick. The other thing is because the disease is so common and has such severe side effects, they were able to get the results in very quickly. So that hastened that as well. So that's just a side comment there. So what is in the mRNA vaccines? Simply put, it's some RNA wrapped in a nanocoat of lipids. And the reason for that is so that the lipids can be accepted into the cells much more easily. There are salts and sugar, and there's some acetic acid, vinegar. These are intended to stabilize the vaccines for storage and for transport and that sort of thing. So what does the mRNA do? It gives the body instructions, and one could get very technical, but I'll try not to. It gives the body instructions on how to make the spike proteins. So that's what the mRNA goes into the cells, and then the cells produce the mRNA spike protein, or the shaped protein. These are then recognized by the body, and then antibodies are made against those spike proteins. So along comes the COVID virus in a real life situation, and the virus immediately is recognized by the immune system, and the idea is that it's immediately and quickly done away with. And that's sort of what happens to that. Initially, when RNAs were first talked about in 1990, they couldn't figure out a way how to get them into the cell without being destroyed. So that's a problem that's been solved in the last while, but it's been more than 10 years as well.
Question for you with regards to Pfizer, Moderna. Will the mRNA in that vaccine alter my DNA?
that has been one of the allegations, hasn't it? But the DNA, and I'll talk a little bit about the structure of the cells. A cell has a nucleus. The nucleus is in the middle of the cell, and the rest of it is a cytoplasm. The DNA lives in the nucleus of the cell. The RNA is in the cytoplasm. So this mRNA goes into the cytoplasm, it stimulates the production of proteins, and then is immediately itself destroyed. So it cannot enter the cell, it does not enter the cell, and it does not live very long in the cell. Sorry, it does not enter the nucleus, and it does not live very long in the cell. So it cannot alter the DNA, and that's the reason behind it.
Another question related to that structure of the vaccines. Are there aborted fetuses in vaccines?
Okay, again, two answers. Simple one is no. The more complicated one is the explanation for it. Back in 1973 and in 1986, there were 2 aborted fetuses that were used for cell culture. And these cells have been cultured now millions of times, thousands of generations. They have been altered, and we currently have stuff that's, these cells have not, they've been in the lab. That's where they are. So the argument is, and I think we have to respect that one, is this ethical? There's a human ethical question there that some people will have, and we each have to answer that to our satisfaction. But the cells are old, they have been modified extensively, and they are used in the development of some of the vaccines, not in the mRNA vaccines. They're used in the testing of the vaccines even now. But this process has the estimation is that it saved about 4.5 billion infections. These cells, these fetal cells, have saved 10 million lives. So I'm thankful for them, but they're not at all in our vaccines. There's no fetal tissue in the vaccines.
Another question related to the vaccine. Is there a microchip tracking us through the vaccine?
I would find that very painful to have a microchip that big injected in me, but they do have very small microchips. There are nanochips available, and I've seen a picture of one sort of sitting inside the bevel of a needle. So they're a couple of nanometers. They're very tiny, speck of dust, but they don't have a power source. They are injected, and at this point, experimentally, they're using to monitor temperature. And they require an external power source to allow them to work. The ultrasound unit has to be sitting outside the body to allow these things to work. So there's no tracking possibility in any of these. So the other question was, so supposedly you have a bunch of microchips in this vial. There's 6 doses in the vial. How do you know how many microchips a patient is getting and so on? So it just becomes a physical and theoretical and scientific impossibility.
One more, and you may well have heard of this as well. Why are people having magnets stick to them after getting vaccinated?
Well, yeah, I was thinking of having one stuck to my forehead or something like that when I come here. It works with double-sided tape. I haven't tried it, but I've seen it, I've heard about that. Yeah, can you imagine a magnet that powerful that it will be affected by, the speck of dust? That will cause spoons to attach themselves to you. It just becomes quite difficult. Plus, it has to work through an inch of skin and tissue.
AstraZeneca vaccine risks. Dr. Kliewer, what is the risk of clots with this vaccine? I know that Dr. Bueddefeld referred to it earlier.
Okay. There are some clots, VITT, the VIT syndrome. It has to do with vaccine-induced thrombocytopenia. It's rare. It's 1 in 60,000 to 1 in 100,000, and some countries will say 120,000. So that's very rare, and it's less rare. Sorry, it's even less likely after the second dose of AstraZeneca. One can compare this with the risk of blood clots in pregnancy, much, much greater than that. In birth control pill, much, much greater than that. In COVID admissions, if you admit somebody to COVID, there's a 16.5% risk of blood clots, and that has to be dealt with during a COVID admission. So the risk of getting a blood clot, yes, they're serious blood clots. They can be very serious blood clots, but the risk is so much less than the benefits, and so much less than the kinds of risks we live in every day.
Quick, let's follow up with that a little bit. Who is at risk with this reaction, maybe, and why, perhaps?
Generally, younger people. That's why the AstraZeneca is sort of not being used as much in younger people now. We're drifting a little bit towards the mRNAs, but it's been used safely and well in people in general. Both men and women can get it with respect to AstraZeneca, but as I say, you also get this vaccine. You also get the blood clots with the COVID, and much worse.
How about the second dose? Is it safer to get a second dose of something else, or what's the current recommendation?
Well, the current recommendation that was very recently announced that after AstraZeneca, so some people will prefer having a second dose of AstraZeneca, and that's fine. The risk is lower, and they can do that. If you combine dose 1 with AstraZeneca and then add an mRNA, that gives you better coverage than I had a little formula here that the AstraZeneca plus mRNA is about equal to 2 AstraZenecas, and it's better than 2 AstraZenecas. The AstraZeneca plus the mRNA is about equal to a double dose of mRNA. So that's the effect.
Okay, one more related to AstraZeneca. I'm waiting 12 weeks before I get my Pfizer dose after initial AstraZeneca. Some friends haven't even waited 6 weeks, also initial AstraZeneca. I'm able to isolate better than many. Might the wait be worth it?
I don't think we know that. At least I certainly don't. Initially, the studies were done with a 3-week wait, but then it was felt good to emphasize the first doses in people's arms. And so by necessity, that delayed the second dose. And then they found out that the antibody levels were actually even better. The net immune result was even better if you wait up to 12 weeks. Right now, I think it's, correct me if I'm wrong, Dieter, can you help me here? 8 weeks is sort of the minimum.
It is longer. I don't know exactly what the number is that they've decided on now,
but there's no harm done waiting for 12 weeks. My second dose will be, I think, about 8, 9, or 10 weeks after my first one was.
Okay, back to you, Dr. Bueddefeld, with regards to should I get the vaccine? My question, can pregnant or breastfeeding women get the vaccine?
The short answer is yes. And although pregnant women were not included in the initial trials with the vaccine, there's reassuring evidence from a few sources that it is safe. There were a few cases where trial participants were pregnant without knowing it, and none of these subjects experienced harms from the vaccine. There have also been animal studies done, which have not shown any safety concerns for pregnant animals or their babies. And thirdly, early information from surveillance studies that include about 35,000 women who have received mRNA vaccines so far has also been very reassuring as far as the safety of the vaccine for both mothers and infants is concerned.
And
Um,
related
I was
to
gonna,
that,
I was
is
gonna,
it safe? Oh, I'm
actually, I'm
sorry.
just going to add one more thing to that. It's also important to know that that pregnant women are at increased risk of severe effects from COVID infection.
Okay.
So that vaccination is strongly recommended. And because most of the information available is on mRNA vaccines, that's the type of vaccine that's recommended by the National Advisory Council on Immunization.
Related to the previous question, is it safe to get the vaccine if I'm planning to get pregnant?
Yes, it is. There's no evidence to suggest adverse effects of the vaccine on fertility.
Okay.
In fact, I phoned the fertility clinic in Winnipeg yesterday, and they are recommending this vaccine to not only the pregnant patients, but the ones who are trying, who've been referred for infertility investigation. They're giving them the vaccine or recommending the vaccine.
Okay. Thank you. I have an autoimmune disease. Can I get the vaccine?
Yes, you can. Autoimmune diseases, any kind of chronic disease, puts a person at greater risk from COVID infection, and that those chronic diseases include, in addition to autoimmune disease, things like heart disease, lung disease, diabetes, many others. So vaccination is even more important. Specifically with regard to autoimmune diseases, these diseases are often treated with medications that suppress the immune system in some way. And as a result, that can alter your response to the vaccine. And it's always very important if you have one of these conditions or are on any medication that would suppress your immune system, or if you have a suppressed immune system for any other reason, that you discuss the vaccine with your doctor. But I think all evidence supports getting the vaccine, in particular if you have an underlying chronic condition.
Dr. Bueddefeld, how would that relate to having allergies? Similar advice or similar circumstances?
Specifically for COVID or any vaccine for that matter, severe allergic reactions are pretty rare, and they occur within a very short time after receiving the vaccine in general. And that's why we're always asked to stay for 15 minutes after receiving the vaccine, so that if a reaction develops, it can be effectively treated. If you have a history of severe reaction to any components of the vaccine, you shouldn't receive it, and you should discuss options with your doctor. Other types of allergies, sort of environmental allergies, hay fever, things of that nature, those would not be an issue in general for receiving the vaccine safely.
Speaking of safety, what do you recommend with regards to should children get the vaccine?
Children age 12 and up can currently receive vaccine. In Canada, the only vaccine I believe that's currently approved for children between 12 and 15 is the Pfizer vaccine. There are studies being done on the other vaccines for children in that age group, and there are also studies on younger children being done, and it's expected that approval for younger children will be coming sometime in the next year. So right now it's only aged 12 and up.
And the question is, why would a 12-year-old get the same dose as an adult?
Well, our immune systems, pretty much regardless of our age, respond vigorously to the challenge of the vaccine, as opposed to things like medications where the amount of medication or the medication has to be diluted in the patient's bloodstream. an adult will have a larger body and more blood to be diluted through, and therefore would require a higher dose of medication to achieve the same effect, for instance, in a child. But in the case of vaccination, the body size really doesn't play a part at all. The response of the immune system is the same whether you have a tiny dose or it's the same for all ages with the same tiny dose.
Okay. This question relates to COVID. I've had COVID. Should I still get the vaccine? And perhaps related to that, if you're recommending that I do, how long after should we wait to get the vaccine?
Yes, you should get vaccinated even if you've had COVID infection. It's not known yet how effective the levels of immunity after infection are or how long they last. So everyone should still receive the vaccine to ensure that they get the maximum long-lasting immunity. After an infection, I think you should probably wait 8 to 10 weeks before you get the actual vaccine. And if you've had severe disease and have received something like immune globulin to treat the disease, then it might be longer. And it's, again, something that you'd have to individually discuss with physician. But you should be vaccinated even if you've had COVID infection.
We've heard the term herd immunity a lot. How does it work? If someone is vulnerable, they can get the vaccine. Why does me getting the vaccine matter?
Herd immunity. I was trying to figure out how to put this into words that make sense. So forgive me if they don't. But herd immunity to COVID or any type of infection is reached when enough people have been vaccinated or enough people are immune so that any person, remaining person who is susceptible and is infected with that virus would pass it on to less than one other person on average. And that would be because everyone or almost everyone around them already has immunity. So that would mean if now, for instance, I would, I don't know, go to the grocery store and run into, I would have, say, COVID unknowingly, I would run into half a dozen people who had not been vaccinated. I could potentially infect all of them, and that each one of them could infect more than one person, and the number of infected people would grow very rapidly. But if enough people are immune, I would go to the store, and of those 6 people, 5 have been vaccinated. There's only one person who's susceptible. I can pass it only to one other person. Then, of course, the number of infected people cannot grow, and ultimately, if the number of people that we can pass an infection on to on average is less than 1, then the number of people that are infected slowly will decline in the population. Now, the number of people, or rather the goal, I guess, of number of people that needed to be vaccinated in Canada to achieve herd immunity was initially around 70%. And then some of the variants from around the world started to present themselves, and these variants are more contagious in many cases than the original version of the virus. And for that reason, now the herd immunity level, the goal, the target level for herd immunity in Canada has been raised to 75 to 80%.
One last question for you. Why do I need a vaccine for something I have a 99.7% chance of surviving?
Well, that's a good question. A few things to consider. although your own specific risk of having a severe outcome from COVID might be quite low, people in other age groups or with underlying conditions are much higher risk, and you may put them at significant risk if you can transmit the infection to them. So protecting those around you is part of the benefit of getting the vaccine. Another thing that might play a part here is the fact that the virus, if the virus is allowed to persist and spread, it's more likely that we could in the future see more aggressive variants develop, and that could elevate the risk of infection and the risk of a bad outcome even further. And I would think that even at 99.7%, or which translates to about 1 in 330, that risk is quite a bit higher than I would be happy with accepting, especially when there is an almost risk-free option available, i.e. the vaccine as an alternative. At present, the reported risk of dying from COVID after vaccination is approximately 1 in a million. So I would take the 1 in a million over 1 in 330.
Thank you. Dr. Kliewer, this relates to COVID itself, and I'm quoting the question as it was submitted. COVID is like the flu and only about sniffles. This isn't a real crisis, as no one I know has been impacted. There seems to be misinformation on the COVID impacts. Is it really as bad as people say it is?
And a simple answer and a longer term answer, but I'll give you the longer term answer here. Coronaviruses cause about 20% of our colds. COVID is a coronavirus, but COVID is not at all like the flu, and it's certainly not at all like the typical sniffles. I'm wondering, whoever asked the question, whether they really did not know anybody who was not affected by or impacted by COVID. So I agree, there may be a lot of misinformation, but it's not the kind that this question is talking about. It is really as bad as people say it is. I mentioned that in my introduction. So it is really as bad. It's impossible for, just think of the possibilities. For a hoax like this, if we call it a hoax, for a hoax like this to take over the majority of the countries of the world, hundreds of thousands of doctors, and people are not breaking rank. There are a few that are really outliers who are saying some really spectacularly ridiculous things. But in whole, the doctors and countries are all working on this. How could that possibly be a hoax? People these days are very quick at trying to, discover the hoaxes and get the answers to it. And I think that's what we need to do as well. And that's one of the reasons we're doing this tonight.
My next question. We have heard a lot about ivermectin in our communities, that this can be used to treat COVID, but government and pharma just want to push vaccines, and so therefore are burying the benefits of ivermectin. So as related to that, ivermectin is not being used because there is no money to be made off of it, because the patent is expired and they want to make money off of the vaccine. How do you respond?
If ivermectin worked, doctors would prescribe it, because doctors don't get money for prescribing things. And ivermectin is available, but it's designed for horses and for cows and for parasitic infections. So the doses are high and they're potentially toxic in people. Initially, there was thought to be a theoretical advantage to using ivermectin. There was a theoretical reason to use it, but there were many small and poorly designed studies. And now the Food and Drug, not Big Pharma, but the Food and Drug is saying not recommended because there are drug interactions with blood thinners and many other drugs, and the high doses may be toxic. So what they're saying, the best I've read about it, is that there is reason to work at further studies to do further head-to-head studies. So there's some potential, but at this point, no, don't do it.
Thank you.
And with that, I guess I should talk a little bit about hydroxychloroquine. Can I do that?
Sure, go right ahead.
That's been a big question as well. And initially it was touted as the cure-all, as the breakthrough, that'll just end all our problems, the routine. That has not borne out. There were some small studies, but the big one, the best one that I heard about, hydroxychloroquine is used for other diseases as well. It's used for rheumatoid arthritis, for instance. It's used for lupus erythematosus, for instance. So they took, in England, this is a large study there, they took people who had these diseases, who had lupus, who had rheumatoid arthritis, and they found 30,000 of them who were taking hydroxychloroquine for this drug, for these diseases. And then they looked at 164,000 people with the same diseases, and these were matched, same diseases, who were not on hydroxychloroquine. And they didn't find any difference. So that to me is a very telling statistic. There are doctors who will go from their personal experiences and who will really tout this, but I find people going from their own personal experiences, that tends to be useless. It tends to be almost by definition inaccurate.
Thank you. Let's shift gears a little bit. Dr. Bueddefeld, getting the vaccine. Where have you heard that we can go get a vaccine?
Well, here in Manitoba, there are a number of options. Of course, we have a super center in Morden. There are some others throughout the province. I think the best route to go is to make a phone call or to check the online website. I don't know if I can give you the phone number now, or I guess all that information will be.
We can post all those numbers later on, sure.
Yeah, so that check out those sources and call and make an appointment. Find out where you can get in most quickly. Find out what's most convenient for you. There are a number of options available. Take advantage of the one that suits you the best.
And we received word today that Altona will be receiving a pop-up clinic in July. The date has not been determined, so we're excited about that. We've said that closer to home is an opportunity for us to find out more and work with that. So then the next question related to getting a vaccine, which vaccine should I get? What would you recommend?
There aren't a lot of hard recommendations. One of them is that the only vaccine recommended in children aged 12 to 15 is the Pfizer. And then the National Advisory Committee on Immunization recommends that mRNA vaccine is the one that should be given in pregnancy at present, since those are the ones that have the most evidence behind them at this point in time. And the advisory committee also made a recommendation, I think back in April, that AstraZeneca should be reserved for patients 30 and older because of the reduced risk of the VITT syndrome. So those, I think, are about the only hard and fast recommendations. Dr. Kliewer mentioned something about, higher immunity levels if you get a certain one after a certain first one. I don't know how strong that evidence is, and I think that the bottom line is overwhelmingly get the one that's available. If you have access to an AstraZeneca vaccine, take that. If you have access to Pfizer or Moderna or whatever it may be, take advantage of that. The benefits will far outweigh any risks.
We have a number of questions related to after the vaccine. and some related to possible long-term effects or side effects, but related to children. What possible long-term effects for children getting the vaccine? This was submitted tonight. And then more specifically, what if I have a child with special needs? Should I be worried? Dr. Kliewer.
Well, the long-term side effects of children are probably, I would think, not that different than long-term side effects of adults. There are very few long-term side effects of vaccines. These vaccines, we've mentioned that the viral vector vaccines, they've been known for years, and the longer term side effect there of that vaccine is that there's immunity. So that's good. There's been no evidence that there has been long-term side effects of those vaccines. We haven't used this vaccine long enough to gauge what the likelihood will be, but there is no theoretical reason to assume that that it'll be any different. And in terms of the mRNA, again, the longer term side effect of the vaccine is immunity or relative immunity, almost complete immunity. The mRNA isn't around anymore. And so when we compare that to long-term side effects of the disease, big difference.
This one relates to why do reactions vary from people to person? Perhaps back to you, Dr. Kliewer, to expand on that.
I won't expand much. People are different. They'll respond differently to different things.
Okay, thank you. And what are the benefits of getting a vaccine? We are still in lockdown and hasn't provided any changes to my life. The CDC has already released a lot of restrictions, and we are nowhere close to that. Why the differences?
I'd like to just jump back to my previous answer also about the long-term effects of COVID. I'm talking about the long-term effects of the vaccine, not of COVID. Most of COVID patients do recover, but lung damage, shortness of breath is there. There could be headaches, there's decreased smell, palpitations, dizziness. Most of these side effects are mild, but about 50% of patients have what's called long COVID. And so that is my side. Dieter, you were initially going to do this one. Do you have anything to add to what I said?
Very much the same. I think the study that I saw indicated that 35 to 75% of people after COVID infection, and that even those with mild symptoms had lingering symptoms at 6 months. And these included fatigue, muscle weakness, breathing issues, chest pain, memory and attention issues, loss of taste and smell. So the effects can hang around a long time, even after just a mild infection.
As far as, in answer to your question, Al, or was there
Go right ahead.
As far as the benefits of getting a vaccine, we're still locked down, hasn't provided any changes. Yeah, I've had that same question, and I think it's a good one. The CDC has pretty well allowed fully vaccinated people to have free reign to go do all sorts of things that we can't do. So I asked that question of one of the officials here in Manitoba yesterday. And the concern was that there still is a significant case load here. It isn't just Canadian reticence and moderation and all that. There is concern about the caseload. And maybe I'm naive, maybe I'm gullible, but I like to think that the people who make these decisions are making them with more information than what I have.
Okay. Next question. Why do we still need to wear masks and follow other public health orders even after we get the vaccine?
I think Dr. Bueddefeld talked about that as one of the two things that we can use to fight COVID with. And the public health orders are a distant second to the vaccine. The vaccine is the one that we want to go for. Why do we want to follow public health orders even now? There are still people who are not immunized. There are still people who are not immune, who've not had the disease, and the masks are certainly helpful. They're not the be-all and the end-all, but they're certainly helpful. So I do that to prevent, if I'm carrying it, we don't know that for sure. But if I, as a vaccinated person, can carry small amounts, I am protecting people around me.
Next question. I've seen that some people still test positive after getting the first dose of the vaccine. Why is that?
Well, it's for one of two reasons. Either they will have caught the infection before getting the vaccine, or within the first 7 to 10 days after receiving the vaccine, when immunity has not had a chance to build. Or they may be in that fraction of people who did not develop adequate immunity with a single shot. A single dose has been found to be about 70% effective. So they could be in that 30% group and still susceptible to catching the infection and therefore testing positive.
Related to that, will getting the vaccine cause me to test positive for COVID?
It will cause a serologic test to be positive. That's the blood test that tests for antibodies, but it will not cause the tests that test for viral particles, like the ones that are done with swabs in the nose to test positive, because there are no viral particles that are circulating as a result of the vaccine. Yeah, it'll change the serologic test outcome, but not the others.
Next question. I've heard the Pfizer CEO say that a booster within 12 months or annual shots might be needed for COVID. Is this true?
I'll take that. There is still a very high protection rate at 6 months, and we don't know exactly how long that protection will last. Yes, the Pfizer rep has suggested that there might be a need for an annual booster, but from what I read today or yesterday, I forget, that may well not be needed, but it does depend on what the immunity levels will be. We can't predict the future. It's all very new.
We think we have time for one question here, maybe two. Let's go with this one. This was submitted in the past 15 minutes. As new variants emerge, vaccinated people are at risk because of others unwilling to be vaccinated. Do some people's unwillingness to vaccination put the general public at risk and prevent life from getting back to normal for the general public?
I think that's true. Yeah. I mean, the more people, or the less people vaccinated, means that more people are susceptible. And the more people susceptible, the more the virus can spread, the more cases of virus we will have. And of course, as I mentioned before, if one person infects more than one, if everyone infects more than one person, the virus prevalence in the community will only increase. So that's why it's so important to have really everyone ideally, and as many people as possible vaccinated, so that no one is susceptible to infection with the virus, either by the original variant or the new variants or whatever, come what may.
And it's not vaccines that cause the mutations. Sorry, it's not the vaccines that cause the mutations. The virus, every virus will mutate. When it divides and replicates, there's mutations. Most of these are harmless, some are damaging, some damage the virus, but some of them become very significant. And these are the ones that we're talking about. So it stands to reason that if we have more vaccination and more community immunity, there will be less virus around to replicate, and we'll have perhaps fewer. My thinking is we might have fewer variants of concern here. But right now, yeah, they're there because viruses do that.
Dr. Kliewer, a quick follow-up question with regards to, you referred to a 6-month protection rate. And the listener asks the question, is this after the first or the second vaccine shot?
I would assume that would be after one is fully vaccinated.
Okay, thank you. And here's one. There are some people saying that if you get the vaccine, you can shed the vaccine to other unvaccinated people and harm them. Is this true? Who would like to jump in?
I wouldn't mind that one. Dita, have you read about that one? I just read on it today a little bit. Vaccine shedding, viral shedding. The concern there is you take in a virus and you take the vaccination, the virus grows on you and you shed it and give it to all the other people. That is one of those things, one of those myths that's actually based on a grain of truth. And let me add, it's a very small grain of truth. Polio, for instance, was a live vaccine. Well, as live as vaccines get. They're really not living. But it was attenuated. It was modified so that it wouldn't give the full disease. But it did go through the system, and people could get polio from it or could get immunity from it, actually. There are other live or attenuated vaccines, chickenpox, for instance. And I read some numbers. I'm not sure I have those here, but of millions and millions of doses of chickenpox vaccine that have been given, and that is one of these attenuated vaccines, there have been 12 cases of a slight rash. So yes, you can get some viral shedding. It's always mild, it's very rare, and you cannot get it from COVID because here in Canada, at least, none of our vaccines are based on an attenuated virus. I think India is working with one that is, but here it's no possibility.
Okay, thank you. I think I should say congratulations. The two of you managed to make it through pretty well the entire list of submitted questions, and I know there were a lot, so thanks for that. Before we, okay, Dieter, someone has, a listener has posed the question, why isn't Dieter wearing a plaid shirt? So he missed the memo.
I didn't get the memo, exactly.
Closing comments. Who would like to, before we transition, who would like to start? And obviously, it would be nice to hear from you with a couple of closing comments. And again, appreciate the effort that you went to prepare for tonight and giving of your time. So, Dieter, I think you were second last time. Go first this time, and we'll have Dr. Kliewer wrap things up. Go ahead.
All right. Well, I would just close with sort of a summary and basically recap what I said in the opening. We are in the midst of a viral pandemic, and we've got this tool available to us, the vaccine, and it's effective. I hope that we've made that clear in the past hour. And it's safe, and I hope that has also been clear. And if any of those things were not clear, there are some excellent sources online that will explain them perhaps far better than we could. Again, those a number of websites, information sources are going to be made available by the town after this presentation. So I just really encourage everyone to consider those facts, and I hope that they will encourage you to roll up your sleeves and get the jab.
Thank you. Go ahead.
I agree with Dr. Bueddefeld fully. One of the interesting sidelights of this is all the mythology that's going on around COVID. There are a lot of naysayers, there are deniers, and what can we do when we hear something that doesn't sound right? We need to have sort of a significant sense of smell and check it out. There are many websites available. There are fact-checking websites. And and I've always been one to, when I hear something, and if I disagree with it, I like to try to understand the other side. I like to understand where they're coming from. And so we have to learn to check our biases at the door when we go in and look for the evidence and check the evidence on both sides. But the evidence is out there. Sometimes we think with our feelings, and that's not healthy. If you're at all in doubt, talk to our healthcare professionals, talk to the nurses, talk to the doctors, talk to the support staff, and get their experiences and how they have responded to it. And I think you would change your mind.
Okay, and thank you. As you indicated, as family physicians, check with your family physician as well. Good point. A huge thanks to Dr. Kliewer and Dr. Bueddefeld for giving of your time tonight and sharing of your expertise and empathy and concern for this community and the situation we're in. Thanks to our producer, Sarah Radmore, who helped quarterback things tonight. And I guess most importantly, to those who chose to spend the last hour, half hour or full hour with us, we appreciate that. And thank you for your participation. And thank you for submitting your questions. We're very grateful for you to be a part of things tonight. Before we wrap things up, I should mention again, we also received word today that town of Altona has been chosen as a site for a pop-up clinic that will be held in July. Details will be announced as soon as possible, and we will share that with you. Now, to wrap things up, we've also invited residents to share their COVID or their vaccination experiences. And here are some of those responses. Good night.
Hi, I'm Laura Wiebe, President of Kitty Sunshine Daycare Center here in Altona. Our early childhood educators have done a tremendous job navigating this pandemic and continue to do everything in their power to keep our children safe. Small children cannot social distance, whether it's providing diaper changes, assistance with mealtime, or providing comfort and care when our children are hurt. These are all things our childcare providers continue to do on a daily basis. We need our community to be vaccinated so that we can all get back to doing the things that mean the most to us, so that we can let our kids be kids again. I've been vaccinated to protect my family, to protect your family, and our community.
Hey, I'm Joel, pharmacist and owner at Pembina Valley Pharmacy and counselor for the town of Altona. I got vaccinated because I dearly miss my family and love them very much. They live in another province and I've been unable to see them throughout the pandemic. I also got vaccinated because I deeply believe in science. I've studied it my whole life and I don't want to stop now. Getting vaccinated will provide me the opportunity to provide healthcare in my community and keep other community members safe. So get vaccinated. Save lives.
Hi, my name is Kristin and I am a firefighter on the Altona and Rhineland Emergency Services Department. I am the emergency coordinator for RM of Rhineland and Montcalm. COVID-19 has affected all of us differently and in severe ways. I haven't been able to work for 27 weeks. I have close friends who are pregnant, have cancer, autoimmune diseases that are at risk for a severe outcome if they were to get COVID-19. One of the hardest things has been for my family that my sister and her family live less than 10 miles away, but they're in the United States, so we can't see them. Every time we FaceTime, my niece asks me why I won't come play with her, and she's 3 years old, so it's pretty hard for her to understand. My grandpa is 90 years old. He's self-sufficient, lives on his own, cooks, cleans, works at his workshop, and he is a very kind, understanding person. And we were having a conversation, and he was trying to understand the mentality behind the survival of the fittest that people are talking about. He says, if people don't want vaccines, I guess that puts me on the losing end of things, but I'll be grateful that I've had a blessed life. And that was heartbreaking to hear. For my family, it's very simple. Get a vaccine. You're going to reduce the strain on the healthcare system. We're going to open borders. We're going to reduce the risk of severe outcomes for people we love. It's so safe. It's so easy. I chose to get a vaccine because my grandpa needs to know his life matters and he deserves to continue living a high quality, healthy, happy life.
Hi there, I'm Katharina Giesbrecht. As many of you may have heard, recently I was hospitalized with COVID and pneumonia. It was a very scary experience. I had wonderful doctors and nurses to take care of me. I know there are some people that have been lucky to come home and blessed that have been able to get rid of COVID, and there's some that have not. I'm going to get vaccinated this week. God gave us a free will to choose the right path. He also gave us doctors and meds to stay safe and well.
Hello, my name is Batchelor. I'm the Chief of Police for the communities of Altona and Plum Coulee. These past 16 months have been extremely difficult on all of us. Maintaining an operational police service is one of the many reasons I chose to get vaccinated. Please consider getting vaccinated. If you have any questions, talk to your healthcare professionals. Thanks for your consideration. Thanks for watching. Stay well, and we'll see you soon.
Hi, I'm Joanna Ginter. I was born and raised in Altona, and now I'm raising my family in this community while working at the hospital as a lab and x-ray technologist. I wish to share my personal experience and thoughts that led me to choose to be vaccinated for COVID-19. Most major decisions that I make, including the when to be vaccinated, are made on a risk versus benefit scale. After performing my own research on the vaccine and speaking to local physicians, I chose to get it as the benefits vastly outweighed any potential risk of side effects. I also found in my research that the risks associated with contracting COVID vastly outweighed the side effect risks of the vaccine. Being youngish and otherwise healthy, my risk of getting severely ill from COVID is low. Now that I am vaccinated, the risk is even lower. I take comfort in knowing that I have protected myself. I have seen the real devastation that COVID has caused in our community. It has wreaked havoc on our patients, their families, and the healthcare staff. I chose to get vaccinated not only to protect myself as a frontline worker, but to protect my husband, my children, and our community.
Hey everyone, my name is Richard Bage. I'm the pastor of the South Park Mennonite Brethren Church here in Altona. I want to take a quick moment and speak to those that might consider themselves hesitant, to those that are on the fence, to those that are unsure, particularly when it comes to the idea of vaccines. I have no interest in trying to convince you today of the medical or scientific reasons as to why you should or should not get vaccinated. There are a lot of people that are much more qualified to do that than I am. So instead, allow me to say this. In the past 15 years of pastoral ministry, I have learned that one of the most effective, one of the most helpful ways that someone can grow in their faith and in their understanding of God or spirituality is to ask questions. If you had questions of a theological nature, it would make sense that you would go to your pastor, to your minister, maybe your rabbi, to your elders, or to your imam. You would do this because these people are seen as leaders in your faith community, and they are qualified to speak to some of your questions and your concerns. Here in Altona, we are blessed to have a great team of doctors, nurses, pharmacists, and other healthcare professionals. These are people that we know and that we trust. These are our neighbors. These are our friends. Some of them are people that you might go to church with. Others have kids that play on the same ball team as your kids or your grandkids. We know them and we trust them. So again, if you are the hesitant, if you are the unsure, if you are on the fence, I encourage you to reach out to your healthcare professionals, someone that you know and someone that you trust. I'm going to be brutally honest with all of you. When we started talking about vaccines, I was on the fence. I really didn't know if this is something that I wanted to do. I was unsure. I didn't feel like I was qualified to make that decision myself. And so I reached out to my pharmacist. Why? Because I know her. I trust her. She's a friend. I know her family. And we've been friends for a good decade now. I called her up. She spent a significant amount of time with me on the phone, and she took the time to answer my questions and to give me the information that I needed to make an informed decision so that I could do what I felt was best for myself and for my family. So allow me to encourage you to do the same. Reach out to someone that you trust. that doctor, that nurse, that pharmacist, that healthcare professional. Ask your questions. Get the information that you need so that you can make an informed decision for your family and for yourselves. Thank you.